Just like hypertension, diabetes, even some kinds of cancer, this disorder has a genetic predisposition. We know from the literature that between 40 and 60% for different people of the reason why they develop an alcohol use problem is actually genetic. Just like hypertension, diabetes, other chronic medical illnesses, we need to wrap patients around with supports that are medical in order for them to be successful. We know that medications can improve clinical outcomes. We know that patients do, of course, respond to behavioral support, but that behavioral support in isolation, without the medical support to help address the underlying underpinnings of what caused them to develop this problem in the first place, they're not going to have great success if you're only giving part of the solution. So it's a chronic medical illness because there's a couple of different aspects. Number one, it's genetic. Number two, it's progressive. People get worse and worse over time without an intervention. Number three, it responds to medical therapies. Patients do better if you use medications and address brain health. So all of those different reasons, very much like we would see with heart disease or hypertension, has a genetic predisposition, responds to medications. Progressively, there's a decline if there's no intervention. Very similar. So as an internal medicine doctor first, I really have taken a medical approach in building this company, thinking about how we can wrap around the kinds of supports that you do in an interdisciplinary medical team for this disorder, much in the same way that we would for any other chronic medical illness. And that's why this is successful.